my name is Lakeisha Thompson, and I'm a student at Maryville University for nurse practitioner. Today, we're going to check the nervous system and do some of those checks. So we're going to start off with doing the cranial nerves, and we'll start with cranial nerve 1, which is the olfactory nerve, which is the nose, and you're going to use any type of sense and have them put one finger over each nostril as you try the other side. Today we're going to bypass that. He's already passed that and hasn't had any issues with smelling. So second cranial nerve is optic, and that's going to be the vision, and we're going to go ahead and check that now. I'm going to go ahead and look at his eyes with a pen light. Just make sure that they react to light and also consensually, and you don't have to move. You can just keep your eyes straight. And then I'm going to go ahead and make sure that he can check for accommodation. And yes, he is, pupils are equal and reactive to light and accommodation. So cranial nerve 3 is ocular motor, cranial nerve 4 is trochlear, and then cranial nerve 6 is going to be your abducens, all three of which is going to work for his eye movements. So we'll do the 6 cardinal fields of gaze to check that. So I'm going to have you just follow my finger for me. Okay, and he also tested positive for that cranial nerve. Then we're going to go back to cranial nerve 5, and cranial nerve 5 is actually going to be our trigeminal nerve. So I'm going to have you clench your teeth into your jaw. Can I feel that? Go ahead and move your jaw back and forth. Perfect. So we're just checking for tone and tightness of his jaw, make sure it's strength there, and that was all intact. So cranial nerve 7 is going to be your acoustic. And so we're going to just have him do the whisper test to check his ear and hearing. So when I say a word, I'm going to have you see if you can tell me what that phrase is. So, and I'm going to have you just close your ear on this side, on your left.
Cat.
Okay, and the other side.
Dog.
Okay, and that also works for him. We're going to go ahead and do cranial nerve 7. Actually, I'm sorry, cranial nerve 7 is not, did I say cranial nerve 5? Yes, I did. Cranial 5 is trigeminal. Cranial nerve 7 is going to be your, not your acoustic. Cranial nerve 7. Cranial nerve 8 is acoustic, which is what I just did. Cranial nerve 7 is going to be your facial. Facial, we're going to actually do a touch, different facial expressions just to make sure that's positive. So if you kind of going to have you smile, I'm going to have you frown, and I'm going to have you go, perfect. Facial nerve is also intact. Then we'll go to cranial nerve 9 and 10. So we have the hypoglossalopharyngeal, or I'm sorry, glossopharyngeal, and then 10, which is vagus. They kind of work intermittently together, and I'm going to have you just swallow and say ah, and they work together for that. And then we'll do cranial nerve 11, which is going to be the accessory. And accessory, I'm going to have you just go ahead and shrug your shoulders. There you go. And then I'm going to have you try to push on this side of with your head. Okay. Chesting strength that way. Perfect. Cranial nerve 12, which is the hypoglossal, and that actually I'll have you open your mouth and stick your tongue out for me. And also his uvula is midline. And then before when I was checking on 9 and 10, I was also looking to make sure his soft palate was also, and hard palate was able to move when he was saying on. That was all positive as well. So we will move on. We're going to go to more of the coordination and balance portion of the exam. We're going to look at gait, and then we will start off with that. So the first thing is we're going to do the rapid movements. This is going to check for the patient to make sure that they're has a good coordination. So I'm going to have you on with both of your hands, put them on your knees if you can, and then I'm going to have you just kind of flip your hands back and forth for me, and then I'm going to have you do that faster. There you go. So I'm just looking to make sure that that he's able to do that and there isn't any changes in either hand, and they both are more in conjunction with each other, so they work. Then we're going to actually check the Romberg test, so I'm going to have you stand up for me. Round back twist, I'm going to have him put his hands to the side and have him close his eyes for me. I'm just looking to make sure that he's able to stand straight and doesn't get any dizziness and try to fall on me, so that is okay. Did great on that. So I'm going to have you sit down. Oh, actually, nope, stand. I'm going to have you just walk from my refrigerator to there and back. Just walk normal. So right now, I'm just looking to make sure that his gait is stable, it's intact, that he has symmetry when he's walking with his arms on his side. Perfect. You can go ahead and sit back down for me. And so he did look symmetrical and walking, and his gait was stable. So we'll start with touch, more the sensory portion of the exam. So we're going to touch him with the cotton and just see if he can differentiate between me touching him with a soft end or if it's going to be hard, and see what he says. So if he can tell me where it is too. So.
Is that my cheek? On my right cheek. My left forearm. My right forearm.
Okay. So after that was just the touch portion. Now we're going to actually do the pain, and I'm going to use the sharp and the dull end this time before I just did the soft end. So the pain, I'm going to actually do the touch and the with the soft and the sharp end. He's got to identify which side I'm using.
Can you do it again? That's the sharp end.
Okay. And where was that?
On my left cheek. Sharp end on my left forearm. Can you do that again? So that's a soft on my left forearm. Hard on my right forearm. Soft on my close to my hand there.
Perfect. And then now we're going to go ahead and just check for vibratory response. So I'm going to actually use the tuning fork and just touch him in bony prominences and see if he can tell me where, or actually just tell me if he can continue to feel it, and it's the same type of vibration, whether I'm doing it on one side or the other.
Yeah.
Does it feel the same on both?
Yeah, it feels the same on the left and right sides.
Okay, perfect. And then the last portion of that sensory is just joint position. So I'm going to go ahead and take one of his fingers on both ends. I'm going to have you close your eyes for me. Tell me if I'm putting this up or down.
It's up.
Okay, and how about now?
Down.
Okay, same thing on this side.
Up. Down.
Okay, perfect. And that follows for both of those. Also, we're going to check stereogenesis. So I'm going to go ahead and put an object in his hand. I'm going to see if he can tell us what it is. Put this in your hand, close your eyes. Tell me what that is.
It was like a coin.
Perfect. And then we're going to do 2-point discrimination. So I'm going to go ahead and just touch him. And he's going to tell me with his eyes closed if I'm touching him with 1 or 2.
1. 1. 1. 2. 1. 1. 2.
Perfect. Okay. And that also comes back fine. We're also going to go ahead and check extinction. So I'm going to go ahead and use the sharp edge, and he's going to tell me whether that is hard or soft. But he's going to see if he can on both hands if the ends feel any different when I touch either hand. So if the pain, right?
So you want to know?
Close your eyes. Just tell me if you can feel any change in what you feel when I'm touching you.
Okay. It seems the same.
Okay, perfect. And then I'm also going to do graphesio, where I'm going to go ahead and write something, draw something in his hand. And he's got to, with his eyes closed, tell me what it is.
I think it's a heart.
Mm-hmm. And on the other side?
I don't. An A.
Okay, perfect. All right, and then that's that portion. We're also going to do, I'm going to touch different areas, and he's going to point to those areas after I touch them and see if he can tell me where I'm touching. So Point to it.
Oh,
with your
point.
hand. Yep. And then. Perfect. And that's the end of the sensory portion. Now we're going to go ahead and get into some of the reflexes. So superficial reflex, we're going to go ahead and try, and I'm going to actually use Predator for this one. And we'll try and see if when I go up from the umbilicus, if we can actually see any movement. Sometimes you can, sometimes you cannot. Just depends on the patient and also, you know, how you're laying as well too. We're also going to take for superficial, if you have a male, you're supposed to do the cream story reflex, where you will go on the inner thigh and from the proximal to the distal portion, from the patient's testes, you're going to, and from the groin area, you're going to see if the testes will rise up. In this case, we're not going to test that today, but that's what you would be looking for. We're also going to look for plantar flexion or plantar reflex. So what I'm going to do here is just, perfect. So on his plantar surface, we're going to go ahead and check with the heel. I'm going to have him just go ahead and, let's see, let me see, no, ankle conus, let me think about it. No, I can't remember how you do that one now. I have to think about that one for a minute. Okay, so that'll be another one. We'll look at that one in just a second. Next, we're going to do deep tendon reflexes. So I'm going to go ahead and check all of those deep tendon reflexes, and we're going to start off with the bicep. So on the bicep here. What is this? You feel that?
I feel it. I felt it kind of moving when you were up there.
Yeah.
Yeah.
Okay.
I feel like it's moving.
Okay, and then I'm going to go ahead and check here and do his brachial radius. Anything?
I mean, I can feel my arm kind of reacting to it, yeah.
So all of this should be like a 2+. I'm also going to check his back here for his triceps.
That's moving.
Okay. And then we're also going to check his patella. And there we go. And then we're going to go ahead and check his back and his Achilles. Okay, perfect. And then I'm going to check for ankle clornus. So I'm just going to dorsiflex fast and see if he actually had any type of change in pattern, and he did not. So that is the conclusion of our exam. Thank you.